Hello and welcome, dear viewers. Are you someone who truly cares about your health? Then this video is made just for you. Today, we're diving into a critical and potentially life-saving medical topic, heart attack, also known as myocardial infarction. Every single second, heart attacks threaten thousands of lives around the world. Yet many people still don't recognize the early warning signs or know how to respond in time. That's why, in this video, I'm going to provide you with clear, complete, and medically accurate information about the causes, symptoms, emergency response, and most importantly, how to prevent a heart attack. Make sure to watch this video all the way to the end, because what you learn today could one day save your life or the life of someone you love. Let's uncover the truth about heart attacks together. Complete and comprehensive medical information about heart attack, myocardial infarction. Today, we'll talk about a serious medical condition that can determine a person's life or death within minutes. A heart attack, also known as myocardial infarction. A heart attack is a signal from the heart. A heart attack is a serious medical emergency that occurs when a part of the heart muscle is damaged or dies due to a lack of oxygen and nutrients. Medically, this condition is called myocardial infarction. The heart is the most vital and tirelessly working muscle in the human body. It continuously contracts to pump blood, rich in oxygen and nutrients, to every part of the body. The heart itself receives oxygen through coronary arteries. If one of these arteries becomes blocked, the blood supply to a portion of the heart muscle is cut off. This lack of oxygen can quickly lead to cell death, necrosis in that part of the heart muscle. Why does a heart attack occur? A clear and medically detailed explanation from a doctor's perspective. A heart attack doesn't happen out of nowhere. It is the result of a slow, progressive process that often goes unnoticed until it becomes a life-threatening emergency. How does it all begin? The heart muscle myocardium requires a constant supply of oxygen and nutrients to function properly. This vital supply is delivered through the coronary arteries. When one of these arteries becomes blocked, part of the heart muscle is starved of oxygen, and that's when a heart attack occurs. 1. Atherosclerosis, the root cause. Over time, due to various risk factors, fatty deposits made of cholesterol, inflammatory cells, and calcium begin to accumulate in the walls of the coronary arteries. This buildup is known as atherosclerotic plaque. These plaques narrow the arteries. Blood flow becomes restricted. Under certain triggers, such as stress, high blood pressure, or physical exertion, the plaque may rupture. 2. Plaque rupture and clot formation. When a plaque ruptures, the body treats it like an injury and activates the blood clotting coagulation system. This leads to the formation of a blood clot thrombus at the site of the rupture. The clot can completely block the artery. The affected part of the heart muscle is deprived of oxygen. Within 15 to 30 minutes, heart tissue begins to die, a process called necrosis. Why does a heart attack occur and what are its main symptoms? This version is clear, medically accurate, and ideal for video narration, blog, or presentation. Heart attack, causes and main symptoms. A complete and medically detailed explanation by a doctor. Why does a heart attack occur? A heart attack isn't just a sudden event. It's the result of a long, silent process that develops over years inside the arteries of the heart. The heart is a vital, continuously working muscle that pumps blood throughout the body. To perform this non-stop function, it requires its own oxygen and nutrient supply, which it receives through the coronary arteries. If one of these arteries becomes blocked, the blood flow to a part of the heart muscle stops. Without oxygen, the heart cells in that area begin to die. This condition is called a myocardial infarction, or more commonly, a heart attack. The main cause, atherosclerosis. In most cases, a heart attack is caused by atherosclerosis, the gradual buildup of fatty deposits, cholesterol, calcium, and inflammatory cells in the walls of the coronary arteries. These buildups are called plaques. They narrow the artery and slow down blood flow. Under stress or physical strain, a plaque can rupture. The body responds by forming a blood clot thrombus, which blocks the artery completely. As a result, the affected area of the heart is deprived of oxygen. And within 15 to 30 minutes, heart tissue begins to die, a process called necrosis. What increases the risk of a heart attack? 1. Smoking damages arteries and promotes clot formation. 2. Diabetes causes inflammation and weakens blood vessels. 3. High blood pressure puts extra strain on the heart. 4. High cholesterol levels lead to plaque buildup. 5. Obesity and physical inactivity increase heart workload. 6. Chronic stress raises blood pressure and heart rate. 7. Family history, genetic predisposition to heart disease. What are the main symptoms of a heart attack? Symptoms may be obvious in some people and completely silent in others, especially in women and the elderly. Most common symptoms: tightness, pressure, or pain in the center of the chest lasting more than 5 minutes. Pain radiating to the left arm, shoulder, neck, jaw, or back. Shortness of breath, especially with exertion. Cold sweat, pale skin. Nausea or vomiting. Dizziness, lightheadedness, or loss of consciousness. In women, symptoms may differ. Unusual fatigue or weakness. Pain in the lower back or upper abdomen. Mild shortness of breath even at rest. Sleep disturbances. Doctor's advice: take your heart seriously. Never ignore the warning signs. A heart attack is not just a medical emergency. It's your heart calling for help. Early recognition and immediate action can save your life or the life of someone you love. What to do during a heart attack, myocardial infarction. In an emergency, the right actions can save a life, even your own. 1. Call emergency services immediately, for example, 911 or a local number. If someone experiences chest pain, shortness of breath, sweating, or pain radiating to the arm, back, or jaw, don't wait. Call for emergency help immediately. Time is heart muscle. Every minute of delay increases the damage to the heart tissue. 2. Keep the person calm and still. Place the person in a sitting or semi-reclined position. Avoid physical activity. It increases strain on the heart. Support their back and keep their upper body slightly elevated. Open windows or ensure fresh air for oxygen flow. 3. Give aspirin if available and no allergy. Chew and swallow 300 milligrams of aspirin. This helps in the blood and break down any clot blocking the artery. Note: do not give if allergic to aspirin or advised not to use blood thinners. 4. Give nitroglycerin only if prescribed before. If the person has been previously prescribed nitroglycerin, for example, for angina, place 1 tablet under the tongue. It dilates blood vessels and relieves chest pain. Warning: do not give if the person has low blood pressure or hasn't been prescribed it. 5. Don't leave the person alone. Be ready for CPR. If the person loses consciousness, stops breathing, has no pulse, start CPR, cardiopulmonary resuscitation, immediately. Push hard and fast in the center of the chest. About 100 to 120 compressions per minute. Depth approximately 5 to 6 centimeters. If trained, give 2 rescue breaths after every 30 compressions. Continue CPR until emergency services arrive. 6. Avoid common mistakes. Do not let the person drive themselves to the hospital. Never assume it's just indigestion or it will pass. Do not delay by giving painkillers without medical advice. How to prevent a heart attack, myocardial infarction. Prevention is always better than cure. 1. Adopt a heart-healthy diet. Limit trans fats, saturated fats, and cholesterol. Focus on fresh fruits, vegetables, whole grains, legumes, nuts, and omega-3 rich fish. Reduce salt and added sugars. A balanced diet helps control blood pressure and cholesterol. 2. Stay physically active. Aim for at least 150 minutes moderate intensity exercise per week. Walking, swimming, and cycling strengthen the heart and improve circulation. Exercise also reduces body weight and stress. 3. Quit smoking. Smoking narrows arteries, raises blood pressure, and increases clot formation. Quitting significantly reduces the risk of a heart attack no matter how long you've smoked. 4. Manage blood pressure, cholesterol, and blood sugar. Keep your blood pressure below 120/80 mmHg. Control LDL bad cholesterol and manage diabetes if present. Get regular lab checkups every 6 to 12 months. 5. Maintain a healthy weight. Obesity, especially abdominal fat, is a major risk factor for heart attacks. Maintain weight through healthy diet and physical activity. 6. Manage stress effectively. Chronic stress can trigger high blood pressure and abnormal heart rhythms. Use meditation, deep breathing, or relaxation techniques to stay calm. 7. Take medications as prescribed. If you have high blood pressure, high cholesterol, or diabetes, follow your doctor's medication plan strictly. Never stop or change medications without consulting your physician. 8. Get regular health screenings. Routine EKG, blood tests, echocardiograms, and physical exams help detect issues early. Early intervention can save your life. Doctor's advice. Your heart is your engine. Don't wait for pain to take care of it. Protect it every single day. Post-heart attack psychological state and medical complications. A heart attack myocardial infarction is not just a physical trauma, it's a major psychological shock as well. The experience of facing a life-threatening event, hospitalization, and recovery can deeply affect a person's mental and emotional well-being. Psychological effects. 1. Depression. Clinical depression is common after a heart attack. Patients may feel hopeless, emotionally numb, or unable to find joy in life. Depression can delay recovery and reduce adherence to treatment or lifestyle changes. 2. Anxiety. Constant fear of having another heart attack. Worrying about death or panic attacks can affect sleep, mood, and overall quality of life. Patients may become hyper-focused on bodily sensations, like chest pain or palpitations. 3. Post-traumatic stress disorder (PTSD). Some survivors experience flashbacks of the heart attack, nightmares, or intense fear when reminded of the event. This requires psychological support or even psychiatric care in some cases. Physical complications. 1. Heart failure. Damaged heart muscle can no longer pump blood effectively, leading to shortness of breath, fatigue, and swelling in legs or feet. 2. Arrhythmias, irregular heartbeat. Life-threatening heart rhythm problems such as ventricular fibrillation, bradycardia, or tachycardia may develop. These can result in sudden cardiac death if untreated. 3. Impaired blood circulation. Due to the heart's weakened pumping ability, oxygen delivery to organs and tissues is reduced, leading to organ strain. 4. Clotting disorders. Post-infarction patients are often on anticoagulants. Incorrect dosing or poor monitoring can lead to internal bleeding or dangerous blood clots, thrombosis. Doctor's advice. Heart health is not only about the heart. It's about the harmony between body, mind, and spirit. Full recovery depends not just on medicine, but also on positive thinking, family support, and mental well-being. Medical conclusion. A heart attack is not just a blockage in the heart. It is a life-altering medical emergency that affects not only the heart, but the entire body, the mind, and one's way of life. It serves as a powerful signal that something in your health or habits needs urgent attention. Recovery after a heart attack is not limited to medications and hospital care. It also requires mental strength, emotional support, and commitment to a healthy lifestyle. Knowing how to recognize the signs early, taking quick action, and following prevention strategy. If you found this video helpful, please give it a like and subscribe to the channel for more. medically backed health tips. If you have any questions or personal experiences related to heart health, feel free to share them in the comments below. We read every message and may cover your questions in future videos. Take care of your heart because it's quietly taking care of you every second of your life. S can save lives. Remember, a healthy heart is not just a medical goal. It's an investment in your future, your loved ones, and your quality of life.